take your fingers here and move your jaw forward and then slide it back. Good. Forward, slow and purposeful, and back. Open it just a little bit. Just let it relax and come back. Go back. You should feel those neck muscles and back go. Okay, so what we're doing now is we're going to do the temporalis. Oh, you're not done yet. You got to work here. You got to earn your pay. Now, we're on the temporalis. She's done 2 movements, forward and back. Now I'm going to have her go side. I want you to pull your jaw side. Good. Stretch it. Stretch it. I want you to stretch it. There you go. And then stretch it the other way. To the left. Good. Slow and purposeful. Now, she wants to do it quick. I want her to do it slow. Stretch. Come back the other way. And stretch. Good. Now relax. Then I go the other temporalis. Then I let the laser energy build up so the muscle can start to relax. And then I'm going to ask her to do the exercises again. So fingers on, or I'll do this. I'll do this for you, okay? Push into my fingers for me. Good. Push, push, push. And then let it go back and drop back. Drop back. Open your mouth just a little bit. Good. So I don't want her putting her teeth together. I want it to relax. And I can feel that suboccipital, especially on the right side, is more taut than the other. Push forward for me. Push, push, push. Push in here. Push, 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 push. And then go back. There. Now it's starting to free up. I can feel it. Bring your jaw to the right.
That's getting warm.
That's getting warm. Thank you very much. Bring your jaw to the right. I pulled it away. So she let me know that's getting warm. And you're going to get that when the areas are inflamed. It's going to get warmer faster. And then let's go the other way. Good. And then relax. Okay. Now I'm going to come into the masseter and the TM joint. We're going to do the same thing. You need to tell me if that gets warm. All right? All right. Forward, back. 2 times for me. Finger, put your fingers on it. Forward, push into it. Yeah, so you're going to good Kirk Douglas push forward. And then push back. There we go. And then forward. And back. There we go. Feel this relaxing here. I don't know if you can feel it, but I sure can. Now stretch to the right. And then to the left. Stretch to the right, and then to the left. This was really a good one. This is a good spot for you. And we did on palpation, we could feel this masseter was just a knot in there. You okay? Back or anything? No,
I'm just trying to flex it.
Okay. All right. Forward, back for me. So we're going to have to do 2 forward, 2 back, and then 2 side to side whenever you're ready. Whenever you complete the other 2. Good. Stretch it. Now, when we did initial examination, her ability to open, her vertical open was very decreased, just a little over 2 fingers. But you can see her lateral deviation was great, which I wouldn't necessarily expect. It should be a good 4-to-1 ratio. All right, and then let that relax. Now, I'm going to come on to the SCM. Now, we've already done some motions with her, but I'm going to want her to turn her head to the left for me and stretch that. So the job of the right SCM is to turn the head to the left, come back to neutral. One more time. I know that she gets vagal when we do this, so I have to be very careful that I can't. Remembering the SCM fires into that lateral pool, which has the vagus nerve. Then I'm coming to the other SCM. We're going to give her a second. Oh, she's already trained, right? She is so intelligent that I just moved it and she already knew what to do. You're doing a great job. Just kidding with you.
All right. I train easy.
I train easy. Wow. There's not many to do. Come back and relax. Now, I'm going to put it on the traps just for another 60 seconds. And then I'm going to come back and I'm going to actually do it. So she's actively doing the motion. Now I'm going to have her push into my hands. So I'm going to cup the laser and we're going to come in here and then I'm going to ask for some gloves and we're going to do a mandibular release. Okay? We want to get to that. So we're going to do that here. So the last point to do is right here in the chin. This is the jaw jerk reflex, right? So if they're not making their appointments, I like to come in with my reflex hammer, tap them, make sure it's working. right? If you're not making your appointments, not referring anyone to us, then I'm gonna tap you again. So we're just gonna have some fun. But now I have a couple to where I want you to push forward into my thumbs. Good. So she's pushing in my thumbs, not the laser too much, and then back, come back. Now I can control it. This right masseter was much tighter than the other in the subaxis pulse, and that just relaxed for me. Good. Now I don't need to go any further because I felt it stretch and relax and open up. But I want to do the laterals, so bring it to me, laterally deviate, open the jaw and come. There, I have it for you now. So I have it. I have my finger on the masseter, and I'm just holding it, holding it, holding it, holding it until I can start to feel it unwind. And there it goes. There it unwinds. I can feel it unwinding, and I just go until it stops. Good. And let's go the other way. There we go. I have it now, so don't help me. And there it drops down for me, and we're good. So I'm done with the laser. Now the last step is, I'm going to come in, I'm going to do a mandibular release. This is the fun part, because we've done all this wonderful work, and your muscles are hopefully pretty relaxed. How do you feel?
Good.
You feel good? Mm-hmm. All right. Now that they're relaxed, I'm going to come in and I'm going to put my thumbs on the molars and the premolars in the back. And I'm just going to sit there and I'm going to just let her get used to having thumbs in her mouth. Probably not used to having that, right? Been a while since you sucked your thumb? Yeah, so you get to that a little bit relaxed, because when you have a headache, migraine, and TMJ, and a lot of pain, you're apprehensive, right? To say the least. So here we go. I'm going to come in. I'm lightly going to put my hands here. Open for me. Now relax. So I don't want her trying to open for me. This is a dance. It's very light. As it goes, it's going to want to shift, and I'm going to wait. So I'm waiting. I'm waiting. Now the right side is just moving just a little bit, and it's actually coming back towards me. It stops. I stop.
Does that make you feel better?
Now it's coming back the other way. You can feel it shifting on me. And this is great. Usually goes to the good side first and then to the back. Once it stops, I stop. And it comes back. It starts to settle back in. I still need this left side to relax a little bit more before it's going to drop. There we go. It's starting to move on me. So now I'm applying a little bit of pressure, not huge, a little bit. And then you can see her jaw just sort of let go. And now I influence it, I influence it, I influence it, I influence it, and I influence it, and then we're good. Okay? How was that?
Good.
Wasn't too painful or anything of that nature. All right. So, now does it feel like a spa treatment?
No.
No. Okay, let's sit you
No
up.
spa I'm paying for.